Dr. Santosh Desai here again, CVAM Cardiology. I have the distinct pleasure of having, again, Dr. Kargoli, who is one of our interventional and structural heart specialists. We have a lot of patients with atrial fibrillation in this country, millions and millions. And the standard of care traditionally has been to keep these patients on a blood thinner to prevent a stroke, right? That's very important. As you and I both know, there are many, many patients who cannot take blood thinners for various reasons. What sort of minimally invasive techniques do you offer to treat these patients and protect them from a stroke?
As you mentioned, the atrial fibrillation is the most common arrhythmia in the United States. Part of it is because the atrium are not pumping properly, and it's a risk factor for forming a clot. And on top of that, most clots, they come from the left atrial appendage, which is a redundant organ that really we don't know its function. Research showed that clots there increase patients' risk of more than 7% versus less than 1% if no clots in the appendage. In the past, surgeons were performing open heart surgery. They will just clip the appendage and get rid of it. It's open, it's invasive, and so we came up with this procedure where we can go very minimal invasive incision in the groin, and with catheters, we reach the left side of the heart, and then with imaging guidance, we can size exactly the size of this organ, and then we put a plug that achieve a complete seal of the appendage, so no clots will leave that area. And over time, the body will accept it, and 3 to 6 months, it'll be part of the body and sealed, and with the risk of stroke is less than 1%.
If I hear you correctly, because it's minimally invasive, you're going through the femoral vein from the right groin. These patients generally go home the next day, correct?
Correct. Sometimes even at night.
Afterwards, after about 6 weeks or so of therapy, do we generally take these patients off of blood thinners if we find that the procedure was a success?
Exactly, because now after 6 months, the risk of stroke is less than 1%, which is almost to normal population.
Yeah.
So we take them off.
And if you have atrial fibrillation, there are any concerns for being on a blood thinner, or you're not a candidate to be on a blood thinner, come talk to Dr. Kargoli.